Thank you. Please introduce yourself.
Thank you. Is that on?
Yes.
Yeah. Okay, great. Thank you. Good afternoon, Chair and committee members. I'm Dr. Dean Blumberg. I'm Associate Professor of Pediatric Infectious Diseases and Chief of Pediatric Infectious Diseases at UC Davis Children's Hospital here in Sacramento. But today, I'm not testifying in that role. I'm testifying on behalf of the American Academy of Pediatrics in California, representing over 5,000 board-certified pediatricians in the state, and the California Medical Association, representing over 40,000 physicians in the state of California. And I appreciate having this opportunity to speak about the importance of this bill. Prior to implementing a new vaccine, they are studied among tens of thousands of patients, sometimes more, in order to scientifically prove that they are safe and effective. The FDA and the CDC also provide oversight after they are approved in order to assure that we have the safest and most effective vaccines in the world. Childhood vaccination has been so extraordinarily successful that it's easy to dismiss the diseases prevented as mild or not serious as memory of their devastation fades. In my position, I see the bad outcomes of these diseases. For example, prior to widespread immunization, many remember chickenpox as a few days of fever and an itchy rash, a childhood rite of passage. But they don't see the kids that I see, the kids who die or suffer chronic consequences of infection. In this country, about 100 people died every year from chickenpox. Half of these were previously healthy children before we started using the chickenpox or varicella vaccine. Now, death from chickenpox is nearly eliminated. Some say whooping cough or pertussis just results in a few weeks of coughing. They don't see what I see. They don't see children in the ICU requiring a ventilator to breathe because of whooping cough, or 5 infants who died from pertussis last year in California. And sadly, there's already been 1 death in California from whooping cough. If vaccines worked 100% of the time, there would be no need for this bill. If vaccines worked 100% of the time, those who are vaccinated would feel secure that they are protected against these diseases. But vaccines don't work 100% of the time. Depending on the vaccine, they are about 80 to 99% effective, and immunity may wane over time. That's why it's important to have as many in the population immunized as possible to have the highest level of immunity so that if an infectious exposure occurs, transmission is limited. Unfortunately, there's much misinformation about vaccine safety and effectiveness. I won't go into the reasons for this, but let me be clear. There is no scientific controversy about vaccine safety and vaccine effectiveness. The science is clear on this. This is a fact. It's not open to dispute among mainstream doctors and scientists. Whether one chooses to believe this or not is up to the individual, but the science is true. You may hear anecdotes. I've got anecdotes too, but today I'm talking science. In any case, these unsubstantiated beliefs lead many parents to choose to opt out of childhood vaccination. This would not be a problem for those in the mainstream who choose to have their children vaccinated if vaccines were 100% effective, but they are not. And it probably would not be a problem if the small proportion of parents opting out of childhood vaccination was evenly distributed, but they are not. Opting out tends to cluster. Although the overall opting out rate is less than 3% in California, some schools have opt-out rates of 10 or 20%, some 50% or greater. This leaves pockets of children susceptible to preventable diseases. When disease exposure occurs, sustained transmission is the result. And again, it's not just those who choose not to be vaccinated, but those who are vaccinated may be infected because, remember, they don't work 100% of the time. Or perhaps those who are too young to be vaccinated may be infected. And as Dr. Pan mentioned, take a look at the recent measles outbreak. The measles vaccine works great. 1 dose results in about 93 to 95% protection. 2 doses gets that up to 97%. But when measles was introduced in California at Disneyland in December, it spread. The outbreak was amplified, fueled by those not vaccinated, resulting in their infection and also infecting those vaccinated, the 3% that the vaccine did not work. And for those who say that measles isn't serious, that no one has died out of this outbreak, so we shouldn't make any changes, I just say shame on them. Do they want deaths to occur? Thank goodness that there have been no deaths. But make no mistake, measles can be deadly. About 1 out of every 500 cases resulting in death. In fact, more children have died from measles than any other disease. So it's incredible to hear some dismiss measles as just a few days of fever and rash. That's why this bill is needed. There is no scientific reason to opt out of vaccination. And opting out not only puts that child at risk, but the community at large also. In my view, the charge before this committee today is to decide which is more important, requiring vaccines for school resulting in individual health and public health, or allowing a parent to make a choice not backed by scientific evidence. This is similar to other public and private health choices that the legislature has made. For example, requiring car seats for infants or seat belts in cars. These rules are legislated because we believe that they are the right choice, even though some parents might not. I want to digress just a bit about my change of heart regarding parental choice. A few years ago, I was here to testify on behalf of Dr. Pan's previous bill to increase immunization rates, AB 2109, which has successfully mildly reduced the immunization opt-out rate in California. At that time, I spoke of my belief in parental rights in this regard. But times change, and my views have evolved. My father-in-law died last year, which prompted much introspection and reflection on his career. Among his other roles, Dr. Jesse Steinfeld served as Surgeon General of the U.S. about 45 years ago. His approach was to let the science lead to policy decisions. He drew logical conclusions from the best data. Therefore, he took on a variety of public health issues that were considered controversial and radical at the time. He advocated for decreasing environmental pollution, removing carcinogens from food additives, improving drinking water quality, recognizing the influence of media violence on behavior, and most importantly, reducing cigarette consumption and non-smokers' exposure to cigarette smoke. He hit the nail on the head with every one of his positions, and his views are considered mainstream today. When I think about my father-in-law's approach, I come to only one conclusion. Allowing the opt-out for childhood vaccination is the easy way out. Individual health and public health trump parental choice when it comes to vaccination. When the tobacco industry attacked my father-in-law for pointing out the dangers of secondhand smoke, they talked about smokers' rights and individual freedoms, smokers' rights. He countered with what he called the non-smokers' Bill of Rights, which said that the country must free non-smokers from the hazards and annoyance of other people's addictions. In this case, we need to protect the rights of those who choose to vaccinate, to free them from the hazards posed to them from non-vaccinated individuals. This is not a radical step. This will put California with the majority of states, 30, do not have personal belief exemptions. Medical exemptions will remain, which of course is appropriate to have a child's doctor determine whether a child has a medical contraindication for immunization. I will conclude with an analogy that I think further illustrates the danger posed by those opting out. We all want our children to be safe drivers. We worry about them. We make sure that they're instructed properly. We make sure that they are in a safe car. We make sure they wear their seatbelts. There are airbags. The car's in good working order. The brakes work. There's good visibility. We make sure that they drive without being impaired. They don't text. They're rested. They're alert. We make sure they drive when it is safe. Our child can be the safest driver in the world, and yet we cannot protect them 100%. All it takes is one drunk driver. Similarly, we can make sure that our children are healthy, wash their hands, have good nutrition, that they're fully immunized. But all it takes is one unimmunized child to expose them, and they may get a potentially serious vaccine-preventable disease. For those who try to make this a battle between individual health and public health, they're wrong. This distinction only makes sense if individuals are not part of the public. If children are going to school, are in public, we have a responsibility to ensure that schools are a safe and hygienic environment and that everybody is immunized. Vaccines have saved more lives than any other medical intervention in history. This bill is good for public health, it's good for individual health, it's good public policy. I ask for your support on this bill. Thank you.
Thank you. We have about 10 minutes and 44 seconds left. Please state your name.
Hi,
Thank
Jenna Jensen. I am Chief Government Relations Officer at Chalk Children's Hospital. We're located in Orange County. We have 2 children's hospitals in Orange County, 4 community clinics, and multiple subspecialty health centers. So I can speak to you today on behalf of the other 7 children's hospitals and Chalk, the 8 children's hospitals in California, as well as the 1,000 medical staff members on Chalk's medical staff who were very excited that I was coming to speak here today because this is very important to them. So I wanted to let you know, for those of you who don't already know, being located in Orange County near Disneyland, we did have 8 cases of measles come into our emergency department. Children with measles come into our ED this winter. 5 out of the 8 were so sick that they needed to be hospitalized. And just reminding everyone, this is an entirely preventable illness that can be devastating. It can cause brain inflammation, permanent disability, and death. Vaccines have improved the health of children by preventing life-threatening infections like measles. And as Dr. Pan pointed out, the CDC has named vaccines among the top public health victories of the modern century. Yet the protection afforded by vaccines is being eroded by the current anti-vaccine sentiment, which weakens the level of herd or community immunity, which I'm sure you've heard about. So when the level of vaccinated individuals falls below a certain level, the most vulnerable children in our communities, and these are the kids that we take care of at children's hospitals, some of them too medically fragile to respond to vaccines or too vulnerable to be vaccinated, are placed at serious risk, as well as the children who are just too young to be vaccinated. Insisting that children in our schools are protected from deadly preventable disease is not only a common sense public policy, it's a life-saving endorsement of one of the greatest public health achievements of our time. Pediatricians like those you've heard from already today dedicate their entire adult lives to nurturing, advancing, and protecting the health and well-being of our children. Please listen to them and pass SB 277. Thank you.
Thank you, Chairman Hernandez, and members of the committee for considering this important legislation. My name is Leah Russin. I'm the founder of Vaccinate California, a sponsor of this legislation. Over 22,000 parents, teachers, doctors, grandparents who want to raise the immunization rates and protect California's children. I started Vaccinate California because as a mom in Palo Alto, I was concerned that my son was vulnerable to preventable disease. And when I started talking to people across the state, I realized we were all frustrated and worried about the safety of our children and families. A mom of a preschooler and a newborn says she worries about bringing her baby with her to pick up her older child from school for fear of what unvaccinated children may bring. But what else is she to do? Another mom told me of having to put her immunocompromised child in private school because the public school nearby had too many unvaccinated children for him to be safe. A dad shared his concern about whether to take his child into the pediatrician. He worried his son had an ear infection, but he was more worried about what dangerous disease his son might catch. A friend in San Diego told me of measles exposure everywhere, notices at Trader Joe's and Whole Foods. A mother of 8-month-old twins told me she is keeping her children home now until they're old enough for their measles vaccines, and she's angry that she has to do that. They all asked me to tell you that we thought this was already taken care of. We thought that people understood that vaccines are safe and effective, and like us, are vaccinating their children. But as the recent measles outbreak has shown, we were wrong. I'm a mom of a toddler in California. That's a thrilling thing to be, but it's also terrifying. It seems there's something to worry about for our children everywhere. We baby-proof our homes. We put car seats in our cars. We check recall notices. We do our best as parents to prevent these accidents from happening. But to protect my baby from preventable disease before he can be vaccinated, I needed everyone in my community to vaccinate their own families. And that's not happening in far too many communities around the state. Since my baby was born, we've seen measles start here in California and spread to 7 other states and 2 countries. Whooping cough is at epidemic levels, killing an infant in San Joaquin just last month. These diseases are highly infectious and have complications with serious implications like loss of hearing or vision, disability, or even death. And it doesn't take many unvaccinated people for disease to have the upper hand. Those who cannot get vaccinated, those too young, those with immunodeficiencies, those recovering from cancer, they truly need the rest of us to be vaccinated, or they have to become isolated in their own homes as a consequence of somebody else's choice. Despite an overwhelming consensus in the scientific community, there are still some who reject the public health benefits of immunization. Current law allows people to exempt themselves from the requirement that children get vaccinated to go to school. But their uninformed decision creates hotspots of risk where disease can take hold and spread. Personal belief exemptions allow people to jeopardize the health of their own children and community without any medical rationale, and you need to change that. With SB 277, parents can still choose not to vaccinate their children, but they will no longer be able to also choose to send those unvaccinated children off to school, where it is much more likely that they will spread disease. This bill is simply asking that if a family makes that choice, they also reduce the risk of that choice to the rest of us. I'm committed to take every step I can to protect the health of my child. That includes coming here today to ask for your help. I speak for all the moms and dads that couldn't be here today, all the parents, grandparents, nurses, doctors. They asked me to tell you how important this bill is. We need your help to make sure that our children don't get measles, don't get polio, don't get mumps, at the playground, at the store, or when we take them to well child checks at the pediatricians. Vaccinate California's numbers increase every day as more and more people learn about this bill and want to support it. We are the majority, but the actions of the minority are endangering our children. We ask you to help us protect our families. Please close the personal belief exemption loophole and support this bill. Thank you.
Thank you.